name is Dr. Varun and today we will be talking about diabetic retinopathy. So what is diabetic retinopathy? From a medical perspective, let me give you a brief idea about the disease. So diabetic retinopathy is a medical condition where the eye, mainly the retina, is affected because of high blood sugar levels in the body. These are mainly caused by type 1 and type 2 diabetes mellitus. So type 1 diabetes mellitus is mainly due to the insulin deficiency seen in the body, that is usually hereditary causes and seen from birth. And type 2 diabetes is usually acquired and it is a non-communicable disease. It might be due to insulin resistance as well as insulin dependence. What is the main causative factors that are causing these damages to the retina? So let me put it in a layman's term. There is a pipe connecting a tank and there is a blockage in the pipe. So the water going through the pipe decreases gradually and the tank does not get enough of water. Similarly, the retina does not get enough of blood because of the damages that are seen in the blood vessels supplying the retina. So why does this damage happen? Primarily, this damage is caused due to increased blood glucose levels that are seen in type 2 and type 1 diabetic patients. These are mainly due to reasons where the glucose levels cannot be maintained or the medication is not adequate enough, where the glucose levels cannot be maintained below the normal range. And prolonged high glucose levels lead to the damages that are usually seen in diabetic retinopathy. So what mainly causes diabetic retinopathy is the blood vessel supplying the retina gets damaged. Hence, the oxygenated blood reaching the retina gets decreased and there is degeneration of the retina. This degeneration causes visual effects such as blurring of vision, dark spots seen in the eye, as well as other complications such as retinal detachment, glaucoma, that are the further complications of the diabetic retinopathy. So, when you leave diabetes untreated for a longer period of time, this causes blindness eventually if left untreated. But that is the end stage that is usually seen in uncontrolled diabetic mellitus over a period of several decades. Today we are talking about diabetic retinopathy as well as the symptoms that are seen in diabetic retinopathy. So what do you see? What is a normal thing that you see during diabetic retinopathy? Primarily in diabetic retinopathy, we have to diagnose the diabetic condition first. So if you are a patient that is suffering from diabetes and it is uncontrolled, in case your HbA1c levels are above the normal range and it has been the same way for a prolonged period of time and you are unaware of it, or you have been detected late about the diabetic part, then certain symptoms that might appear in your eye, in a field of vision, that you might relate it to diabetic retinopathy. So these are the symptoms that you usually see, and I will give you a brief idea of what you might expect to see if there is any damage to the retina and in case of diabetic retinopathy. So primarily what happens is the field of vision is usually blurred, and in some cases there is floaters that are small black color spots that are seen in the field of vision that are moving around in the eye. So you might see it as an imaginary object that is seen in the field of vision, and the vision is not that clear enough, as you have noticed prior to the diabetic part. And post-diabetic, the field of vision becomes slowly blurred, and what happens is there are black spots that appear in the field of vision. So these black spots might be moving around in the field of vision as well as stagnant somewhere. As well as what happens is in uncontrolled diabetes in later stages, there is complete loss of eyesight. This is seen where the damage is irreversible and the patient can't be recovered and the vision can't be recovered. So these are the few symptoms that we see in diabetic retinopathy.